The district health system strengthening activities revolves around supporting the building blocks of the health systems, and as a partner in the region, we have been supporting the planning process. We have been able to train the district people on the bottleneck analysis process and ensuring that they develop one integrated health plan. We have also been able to track the progress along the domains of the health system using the progression model, and reviewed the actions that they made and ensure that periodically we guide them to improve and strengthen their health systems.
The importance of all this is that at the end of it all, first of all, you realize that you have created a healthcare system that is responsive, that is sensitive and responsive to the needs of the population that you are serving. And then besides that, gradually you will have improved the service uptake indicators and also the health outcome indicators. And therefore, in totality, you will have improved the general health of the population.
Yeah, to ensure that the district-owned activities, first of all, we ensure that all aspect is district-led. Right from planning, we engage them, we provide technical support, and they take the lead in planning. In terms of implementation, we ensure that the key focal persons in the district take the lead in the implementation. And even in monitoring, we ensure that they monitor progress and periodically review the performance that they have to ensure that they own up the results and own up the challenges that they have to address. As a partner, one of the key challenges is the team that we are working with. In some districts, the district health team members are very thin, and in some instances, the key person like the district health officer are not substantive, are not in space, and we also see shortage of health workers, and this affects the implementation of services and strengthening the system.
Some of the partners, the implementing partners, they provide piecemeal interventions. They are not comprehensive enough. So maybe someone can just come and say, okay, for me I'm intervening only in pediatric HIV, and is leaving out the rest of the HIV on the adults, the TB and so on. So you see, now it means in a scenario like that, you must find another partner or other partners that are going to fill into the other gaps to have a comprehensive approach to address the problem in that program area. And you know the challenge is that the more partners you have, the more difficult it is to coordinate all of them.
Yeah, one of the things that we already doing is to ensure that even with this thin DHT, we identify also among the other facilities focal persons that can be trained, whose capacity can be built to help us support the planning, implementation of the activities, and this in a way can help improve things, and then also strengthen the coordination of all the partners to mobilize all the resources. One of the things we want to see is that the district develops one integrated plan, and that incorporates all the support from the partners.
We need to regionalize planning. Instead of having district-specific plans. Okay, you can have the district-specific plans, but this should be at least aggregated, maybe to a regional plan for health. Because if you look at the country setup, in most of these regions, you'll find that in certain regions like Karamoja, for example, we share problems. Our problems are cross-cutting across the region. The same problems you find in Amudat, they are the same issues you find in Karenga and the rest. So ideally, the approach to solve or address these challenges could be the same.
And we also want to really lobby for the government to really recognize Karamoja as a difficult region and have an affirmative action to address the human resource gaps, to add more resources to this region and ensure that Karamoja is out of the bottom in the country.